Good afternoon, and thank you all so much for joining us today for Use Your Voice, Advocacy Strategies for Children's Vision. We've got 75 minutes chock full of information and a bit of time for Q&A. We're really happy to have you here today. I'm going to start with just running through the agenda. I'll say first, I'm Donna Fishman. I'm Director of the National Center for Children's Vision and Eye Health here at Prevent Blindness. I'm a white woman with shortish brown hair, wearing a black jacket and a multicolored shirt today. We're so happy you're all joining us. I'm here with, as my co-facilitator, Sarah Brown, who's our Senior Director of Government Affairs at Prevent Blindness. You'll be hearing from her in a bit. So quickly, we'll do some housekeeping. I'll introduce all the speakers. We've got a terrific lineup. You'll hear the presentations, a few testimonials, and we'll have a great panel discussion. And then we'll turn to a few of your questions, and then we will wrap up and give you a link for the evaluation. So just a few housekeeping items. Please, for questions, put them in the Q&A. You're welcome to introduce yourselves and say hello and where you're from in the chat, but we'll reserve all of the questions into the Q&A. It's easier for the presenters to access. Some of you I know will be looking for a certificate of attendance. We will email this out tomorrow, also this information. If you would like a certificate of attendance, you'll be emailing Ann Wilcock, our executive assistant, who's been instrumental in helping us get this webinar together today. Thank you, Anne, at awilcock@preventblindness.org, and we will give that to you again later. We are recording the webinar, so if some of your friends and colleagues couldn't join today, we'll be sending that link out, and for you, if you wanted to revisit. And all of that, and some resources will come out in the next couple of weeks. And of course, it's really helpful for us for planning future webinars if you do complete the evaluation. So we always appreciate that. Just to introduce ourselves, this webinar is being brought to you by Prevent Blindness and the National Center for Children's Vision and Eye Health. Prevent Blindness, our mission is very simple: to prevent avoidable blindness, help Americans get to eye care. We do that through education, advocacy, and empowerment. We value equitable access to eye care. We are a patient-led organization, and all of our work is based in evidence. We've got a tremendous number of resources. You can see a little graphic here, a little image of some of our resources. The National Center for Children's Vision and Eye Health really was created to support systems of care, both on the national level and for all the states. We provide technical assistance. We have a vision screening certification course. And again, we elevate patient and parent voices. And we have some great resources, including our Small Steps for Big Vision Toolkit. We'll share all these resources out. So let's move right into introducing our great panel of presenters today. I've already told you about me and Sarah, and I want to introduce our other speakers. Their full bios are on the event page. Anne is going to share that link if you wanted to see fuller bios for everybody. But I'm going to just give you very brief bios so we can get right into our program today. Nicole Pratt is the Training Program Director and directs the Leaders Empowered as Advocates with Dignity, or LEAD project, at the SPAN Parent Advocacy Network in New Jersey. She's a single working mom of 2 young adults, both with special health care needs, one with retinopathy of prematurity, which you'll hear about today. She organizes trainings, educates parents and professionals on an array of education and health topics, again, in New Jersey and nationally. We're very happy. She also sits on the advisory committee to the National Center for Children's Vision and Eye Health for over a decade now. Bridget Bernard is a maternal and child health advocate, doula, and certified lactation counselor. She comes to us as a graduate of the Aspect Patient Engagement program, and we will definitely be sending you some information on that. She's a passionate advocate for maternal and child health, and you'll hear she has 2 children with some vision issues. Shannon Duree, is the director of Levitt Partners in Washington, D.C., where she provides federal policy counsel and analysis and assists in managing multi-sector alliances. We are so thrilled she is here today. Susan Hepworth is the executive director of the National Coalition for Infant Health. It's a collaborative of professional, clinical, community, and family support organizations focused on both education and advocacy, promoting patient-centered care for infants and their families. She is one of our project partners, and is Nicole Span and the National Coalition for Infant Health on our retinopathy parent education and support program. Kim Owens is also a graduate of our Aspect Patient Engagement Program. She's unable to be with us today. She's having a nice vacation with one of her sons. She is a parent of a child with a vision impairment. You'll be hearing her story on video. She's a writer, parent, mentor, speaker, and Braille transcriber. And so you're really going to love the testimonials you hear from Bridget and Kim. So that is our lineup for today. And let me just get back to my agenda. And I'm now going to turn the program over to Sarah Brown to give us just a little background on advocacy before we start today. Take it away, Sarah.
Thank you so much, Donna. I apologize. I'm coming off a video. Hello, everyone. Thank you so much for being here. My name is Sarah Brown, and I'm Senior Director of Government Affairs with Prevent Blindness. And today I just want to share just an overview of the EDV Act and just some of the priorities that Prevent Blindness is currently working on. While I'm going through this, I just would encourage everyone, if you want to look up some information about the EDV Act, please visit the link that is in the chat and also in the resources available after this program. So Prevent Blindness is excited that the Early Detection of Vision Impairments for Children Act, the EDV Act, was reintroduced in the House of Representatives on March 31st of 2025. We're excited that this is a bipartisan piece of legislation that is being spearheaded by Congressman Gus Bilirakis, a Republican from the 12th District of Florida, and also a Democrat, Congressman Mark Vesey, who is a Democrat from the 33rd District of Texas. So both of these sponsors are currently leading on this legislation, which seeks to create the first federal program that is specifically designed to address children's vision and eye health. And this is something that, Prevent Blindness ourselves, and especially Donna through her work with the National Center for Children's Vision and Eye Health, we've really identified that there is a lack of funding and focused attention on children's vision and eye health just in the federal structure of all children's health and development programs. So seeing that there was not dedicated funding that specifically went to addressing children's vision and eye health and specifically creating that system of care for children's vision and eye health, we took a look at some programs that were in existence that had been working that we could easily emulate for children's vision. And one of the programs that caught our attention, some of you might be familiar with that, it's the Early Hearing Detection and Intervention Program, or the EDI program. So hopefully EDI and EDV will be two acronyms that roll off the tongue fairly easily as they both focus on two sensory aspects of children's health. So very similar to what the EDI program does, which is has been legislated about 25 years ago. At a time, a lot of infants in our country were not actually screened for hearing disorders and then referred to specialty care. But now with the interventions that the EDI program has put in place, that number is now up to 98% of infants in our country are screened for hearing disorders and then referred to specialty care before 6 months of age. So this really is something that we've seen a lot of strong success on. It's really enjoyed a lot of public support and continues to be reauthorized on a strong bipartisan basis. And so we felt that this program could very easily replicate the success that we saw in the hearing community for those of us in the children's vision and eye health community. So very similar to what the EDI program does, the EDV Act would allow for grants for states and communities to receive direct funding through a competitive grant to implement systems of care for children's vision and eye health. So some states might be doing some practices already. They might be implementing programs around vision screening. They might be referring children to care. Some of them might even have that especially important step of follow-up. But we're not really seeing that happen on states and communities in a way that, really creates uniformity around some of those best practices. But also we're seeing a lot of states take on different approaches. And so what that results in is a lot of different outcomes in children's vision and eye health, but also disparate access to eye care in pediatric populations. So this is something that this legislation would fix by providing direct resources to states and communities to improve their capacity to respond in a systems-based approach for children's vision and eye health. So we believe that this will start out very small right now. By comparison, Eddie, having been around for about 25 years, is currently being funded through the grant side of things at about 18 million per fiscal year. So states receive on average about 200,000 per year to dedicate to their Eddie programs. We'll definitely start a little bit smaller. We're certainly not in an environment right now where we can legislate brand new programs. However, we still believe that a small injection of funding can really go very far to at least begin to address children's vision and eye health. So the EDV program would be funded at 10 million per year. 5 million of that will go for grants in states and communities. And we think that that will start initially about 10 states and communities to receive that direct funding. So recipients of that funding would need to demonstrate at least several activities that are outlined in the legislation that would improve systems of care. So that could be things like public awareness, that could be setting up data sharing agreements, data surveillance practices, accountability measures, and really looking to see where some of those components are missing in their systems of care to be able to implement that at more federal level, and also to be able to get that polished up a little bit so that that system of care is really strong and robust, but especially includes that follow-up to care, which is really essential to make sure that children are actually receiving the care that they need. The second component of that is that there would be a technical assistance resource center housed within the CDC, and that would be funded at 5 million also per year over 5 years. And this would allow for an opportunity for states and communities to receive additional resources just in case they don't receive that initial injection of funding through that grant program. They would still be able to access some information on best practices and guidances to ensure that they are doing something to improve children's vision and eye health, however that looks. So we're really excited about this legislation. We're so excited to start pushing this forward in the House to get some additional co-sponsors, and Prevent Blindness, through all of our advocacy efforts, are really encouraging advocates to take just a few minutes to sign up for advocacy alerts to get information about the EDV Act. But also we do have an existing campaign. If you would like to send a message to your member of Congress about the EDV Act, we really could use a chorus of voices and getting this important bill passed. Donna, back over to you.
Great. Thanks so much, Sarah. And you can hear her passion, and that's why we're here today, to learn about advocacy for children's vision. We'll be also touching, Shannon, we're so happy she's here, is going to be touching on some rare disease advocacy as well. And so just to do a little level setting, and I should have really put up our learning objectives, I realize, sorry, is that our advocacy we talk about in two different ways at Prevent Blindness. One is what we call small a, which is advocating for programs and services. And the other A, big A, is more the public policy advocacy. So Sarah just gave us a great example of the EDV Act, which we're so excited about, to finally have a federal program around children's vision. And then there's also advocacy where you will be, hopefully, some of you parents out there, some of you professionals, and the focus today is really on how do we advocate to get the best services and best outcomes for children in this country. And so I just wanted to do that little bit of level setting, because we hope what you'll take away today are some tips for doing your own advocacy and for empowering parents and families that you work with to advocate, both on the systems level in their own school districts and healthcare systems, and then also on the policy level, which could be local, state, and federal. So I think you'll come away today with some great tips, and we're excited to dive right in. We're going to start with Kim, who I mentioned isn't able to be with us today, but she has recorded her testimonial and about her son Kai and his vision impairment. And we're going to start out, and then we'll lead into Nicole's presentation on advocating for health services and education services. So we'll start with the little a, and Moyo, go ahead, please play Kim's testimonial.
Kai was born a daredevil. By age 5, he was backflipping off boat docks and skateboarding down 6-foot half pipes. Then suddenly, he became introverted and afraid. He was terrified of the dark, refused to play outside, and started compulsively pressing and pulling on his eyes. Over the next 3 years, we visited a variety of specialists and received many diagnoses, but nothing improved. I have multiple autoimmune diseases, and asked each doctor if Kai's symptoms could be autoimmune, but each doctor said no. Just before Christmas, I asked 10-year-old Kai to write his wish list for Santa. I noticed he curled over the table and that his writing started in the center of the page with the words jumbled at the right margin. I asked, why didn't you use the left side of the paper? He sat up straight, held the paper to eye level, shifted it to the right, and said, I didn't see that side of the page. Alarmed, we rushed to the optometrist, who noticed gold flecks of pigment in his retinas. We were referred to a pediatric ophthalmologist who diagnosed Kai as legally blind with a progressive genetic disease called retinitis pigmentosa, or RP. We had no family history of blindness, but 3 specialists confirmed the diagnosis. They described RP as slow and relentless, but couldn't explain why Kai had lost his sight so quickly. We notified the school and created an IEP for 5th grade. In rural Georgia, all the educators said, we've never done this before. I hadn't either, but I had to become a strong educational advocate. Kai attended every IEP meeting and eventually began to speak for himself. He learned O&M, Braille, and assistive technology. We knew he should have access to the same materials at the same time as his peers. When that didn't happen, we went up the chain of command. Teacher, TVI, IEP team, SPED director, principal, superintendent. And when that failed, we filed a formal complaint with the State Board of Education. It wasn't easy, but Kai got what he needed to succeed. Together, we started mentoring other families. After meeting Kai, one boy was excited to use his cool white cane, and another family decided to advocate for Braille. Kai graduated as valedictorian and received a full ride to the University of Georgia to study music theory and jazz drum set. Kai's diagnosis of RP never felt accurate. When he was 18, I read about a retinal specialist researching autoimmune retinopathy. We drove 6 hours for a consultation, and a simple blood test proved it was autoimmune disease, plus 4 never before documented changes to his ABCA4 gene. Finally, an answer that made sense. However, our relief was short-lived when the doctor said, too bad he wasn't tested for autoimmune disease sooner, we might have saved his sight. He recommended trying to save Kai's light perception with monthly steroid shots in the eyes. Kai tried the shots twice, but then the doctor wanted to add biologic infusions, which would leave him immunocompromised, not ideal when entering college during a pandemic. Kai felt the treatment was too invasive and declined further treatment, stating, I'm already blind, I have strong blindness skills, and I don't want to be immunocompromised too. It was his choice. He was an adult. The doctor said, you'll be here in 10 years in total darkness, and there will be nothing I can do to help you then. Light perception matters more than you think. Miserable, suicidal, blind people line up here every day begging for my help. Kai responded respectfully but firmly. You must know different blind people than I know. When Kai rejected the doctor's negative perception of blindness, I knew my work was done. Kai had become a strong self-advocate. Kai's a senior in college now, living independently with 2 roommates and his guide dog. Next year, he's moving to Manhattan to start his jazz career. Parents, I know it feels intimidating to advocate for your child's needs, but it's important to remember that your kids gain their confidence and advocacy skills from you. Thank you. You can follow me and Kai at navigatingblindness.com or on social media at navigatingblindness.
That was such a powerful video, and it's been such a pleasure to get to know Kim and hear her story with Kai. And I hope you feel as inspired as I do by her advocacy and Kai's self-advocacy. I'm now really happy to introduce Nicole Pratt. Come off mute now. And Nicole, you will hear, is, as I said, a mom of a son with vision impairment and also a fierce advocate in her professional work. So Nicole, take it. Let me share my screen. Okay, take it away. Thanks, Nicole.
Thank you, Donna. So good afternoon or good morning, depending upon where you are. I am a brown-skinned woman and I'm wearing a beige top here today. And so I'm going to talk to you about advocacy and the importance of heightening your advocacy, especially when it comes to getting medical care, and then a little bit about advocacy when it comes to schools. But I'm definitely going to focus a lot around the medical care piece. And so when we are advocating for services, health insurance is at the forefront of this, right? We need health insurance to be able to receive eye care treatment, just like any other medical condition. But we also know that with health insurance, depending upon the type of health insurance a person has, will depend upon the level of eye care that they can receive. And so we know that many people have a variety of different health insurance coverages. We have private insurance that you receive through your employer, which many times, as of the last many years, your employer will only offer you one type of health insurance. And maybe it will have eye care in it, or it has it, and sometimes it's just to get the eye exam. But some people need more than that. They need medical treatment. And so you're kind of stuck. And then the hope is that they will offer you a separate type of eye vision insurance that would offer you a little bit more. And then you have individuals who receive their insurance through their state Medicaid office. Each state has a Medicaid program, and it's called something different, but all states have what's called a children's SCHIP, Children's Health Insurance Plan, within their Medicaid system. And so when it comes to children receiving their insurance through their Medicaid system, that will depend on the level of Medicaid you receive as well. For many children who may or could be eligible for the supplemental Social Security income, which is through the Social Security office, otherwise known as SSI, that type of insurance is under the program called Age Blind and Disabled. And so I always equate that to like the Cadillac of Medicaid health insurance, because it does cover a lot of different things and more than one eye visit a year or treatment. And then you have the marketplace. And so we've had the federal marketplace now for many years. Many states have chosen to create their marketplace. So even within the marketplace, it does give you the ability to select the health insurance that you want. And then you can look at what is the coverage that I need. And so when I started this journey with my son, who is now 24, he was diagnosed as an infant. He was premature. He was born at 26 weeks, and he was actually diagnosed just before he was in the hospital for about 3.5 months. Oh no, 2.5 months. He was screened in the hospital, and that's when they told me that he had what's called a interventricular hemorrhage, a brain bleed, a stroke in the brain. And so that's what caused one of his diagnoses. He also has an intellectual developmental disability. And so the doctor informed me, he said, well, we did the eye screening here in the NICU, and it looks like he has possibly retinopathy of his eyes, but I had to get further testing. And so at that time, I had private insurance. He wasn't on the Medicaid at that point yet. And I remember making the appointment to go to the eye doctor to have him looked at further. And I remember going to a hospital-based eye doctor's office. And it just so happens they scheduled me on the same day that they also, so some places schedule people who have Medicaid health insurance on a particular day of the week. And I remember going there, and the woman, and I'm waiting there. It's like 10 minutes, 20 minutes. And I said, my son's appointment time has passed. They're like, well, you're here because, it's the Medicaid day and you have to wait. And so I looked at her and I said, I don't have Medicaid for my son. And there's nothing wrong with that, right? But she assumed by looking at me, that I was on Medicaid. And so once I informed her, I said, well, I have private insurance for my son. She then immediately got me in and realized that she made an assumption that she shouldn't have had. But it doesn't matter what health insurance a person has, whether it's Medicaid or private insurance, you should not having a person wait past their time. Right. And so I am a staunch believer, advocacy, no matter what health insurance have, they should not have you waiting. And so I finally went in, saw the eye doctor. They did a comprehensive eye exam and then also stated that your son has retinopathy of the eye and you're going to have to go for further specialists. So I did that. And so I think it's really important that when you are making appointments and going to the eye doctor, that a role for parents is really important to have communication with the doctor. And if you feel like the doctor is not doing you just service, or doing right by you and your child, then you should fire your doctor and find a doctor that will better serve you and your child. I work with a lot of parents that deal with a lot of medical conditions, including eye conditions as well. And they look at me somewhat strange when I say that. And I'm saying, but you're not getting the right services for the doctor. And so, depending upon what your insurance is, sometimes you may have to go outside of your area, but sometimes that's not always um, the abilities for some people, because some people will have travel challenges and limits. But, you know, there are ways of trying to get these services that's really important for you. And the other thing I want to stress here is that, and the other thing I want to say with getting early intervention, I feel was a savior for my son, was getting the services early once he was diagnosed, and he did get vision therapy very early. And I just want to state that when I did go to the ROP specialist, the eye doctor, it was a shocking thing to see, have my son's eyes open. But because he had early intervention, I went to the eye doctor. His ROP did resolve, but he has been left with some different effects. He has to wear glasses. He doesn't have peripheral vision too well. And like I said, he doesn't have an intellectual developmental disability. And so the other part that I want to state to you is that we all have a story, right? And it's important that we level up the stories to policymakers. And in this day and age, it's so important to share stories of whether things are working or things are not working, especially around the changes that Medicaid is under or possibly changing futuristically, depending upon what happens at the government level. And so it's really important that we share stories of the importance of why, especially if your child does have Medicaid, because my son does have Medicaid under supplemental Social Security income in New Jersey, that sharing your story with policymakers now and forever is so important to help them to understand why it's important not to make cuts to a Medicaid system or the federal marketplace system health insurances. So one of the opportunities I had not too long ago was meeting with Andy Kim. He's a senator here in New Jersey. And he met with many of us around the challenges that cuts to Medicaid could pose. His aide sent us an email a few days later and asked us to tell a story. And they said, can you either write a story or do a video story in 50 seconds? And so my brain started working and I said, okay, how am I going to do this? And I said, well, it's really important that they hear from me, but also hear from my son. So I sat down, I wrote 2 sentences for myself and 2 sentences from my son, that you will actually going to see the video in a minute, that Andy Kim actually used and showed on the Senate floor when he was talking about and advocating to not have cuts to Medicaid. And now Donna is going to show that video. It is vitally important that his Medicaid health insurance not be cut. It would be catastrophic to his medical and disability support needs. I now introduce you to Jordan.
Hi, my name is Jordan Pratt. I'm from New Jersey. I have a disability that I need to have my full Medicaid health insurance benefit to take care of my medical and disability support needs. Please don't take that away, my Medicaid health insurance.
So when Republicans are talking about cutting Medicaid, to hand tax cuts to the wealthiest Americans, the choice they are making is to leave people like Nicole and Jordan behind. So many across this country rely on Medicaid for their basic care. In New Jersey, 1 in 7 adults between the ages of 19 and 64 are covered by Medicaid. These are the people that need help, not
Thanks,
Elon Musk,
Nicole.
not the billionaires.
That was a 50-second, but you see how powerful the words are, especially when it comes from my son, who was the one getting the services. And I was so honored that Andy Kim I was one of many that he chose to show that video and talk about us on the Senate floor. So thank you.
Thank you so much, Nicole. Really powerful words, and bravo. I see somebody
Thank you.
just posted that. Bravo, Nicole and Jordan. So we thank you for your presentation and for that video. And so I'm not going to go into too much about what the Aspect patient engagement program is, but one of the things that they do is for people who have vision impairment and allies, to train them. And Nicole is also a graduate. I should have said that before too, sorry. To train to tell their story in 5 minutes. And that's what you heard from Kim, and you are about to hear from Bridget. And not only 5 minutes, but look, Nicole got her story out in 50 seconds. So when it comes to advocacy, you take the time that you are given and you have your your 2 or 3 points and you make them. So really happy to have shown you a 5-minute and a 50-second example of that. So now I'm going to ask Moyo to show Bridget's video, and then Bridget will be with us live during the Q&A. Thanks so much.
Hello, I am Bridget Bernard, a patient, parent advocate, and mother of 3 boys. 2 of my sons live with myopia, amblyopia, and astigmatism. My youngest son has a family history of degenerative myopia, and his grandmother is in fact legally blind. She introduced me to Prevent Blindness, and that is when I began to understand what my children were living with wasn't just a vision inconvenience, it was a serious medical condition. My eldest son, Mason, began his journey wearing glasses at the age of 2, but he likely needed them far earlier. His vision loss went undetected because after his newborn screen, there were no other visual checks. I started noticing eye misalignment around 18 months, and by the time we got a diagnosis, developmental delays had already taken root, particularly in speech and motor skills. Fast forward 10 years later, my youngest son, David, I recognized similar signs, squinting, side-eyeing, and while others found it cute, I knew better. This time, I had access to a simple, affordable photo vision screening test at his pediatrician's office. For just $15, the test confirmed my concerns and led to a referral to a pediatric ophthalmologist. Unlike my experience with Mason in 2014, I could afford it and it was available to me. I think about how many families never even get to that point because of access, cost, or awareness stands in the way. Parents are often the first to notice when something seems off. Here are 2 ways you can advocate for your child. Number 1, trust your instincts. If something seems wrong, speak up. Number 2, ask questions and push for screenings. Don't wait for someone else to bring it up. You don't have to be an expert to make a difference. You just have to be a voice that won't be ignored. Providers, especially pediatricians, early intervention specialists, and school nurses are vital allies. They can help families recognize early signs, offer clear guidance on referrals and treatment, support families through follow-up care and insurance challenges. When providers take a collaborative, empathetic approach, it builds trust and ensures children get the care they need when they need it. The Early Detection of Vision Impairment Act, or the EDVI Act, would establish the first ever federal program dedicated to children's eye health. It would fund early screenings, improve referrals and follow-up, and ensure families get connected to treatment before vision loss becomes permanent. This legislation would mean schools, pediatricians, and families all have the tools they need. And while another speaker will go into more detail, I'm here to say this: policies like the EDVI could have changed Mason's life, and I want to help make sure they change someone else's. Through the Aspect program with Prevent Blindness, I gained the skills to share my story on Capitol Hill and webinars like this and on national panels like the Myopia Action Initiative. Advocacy has given me a voice not just for my sons, but for families who have not been heard yet. It also connected me back to my work in maternal health as a doula and lactation counselor, reminding me that early interventions in health, vision, and support are deeply connected. To the parents, you are your child's first and best advocate. To the providers, your support reinforces our advocacy. And to the policymakers, let's create systems that prevent avoidable vision loss. Every child deserves to see the world clearly and thrive in it. And that starts with us right here, right now. Thank you.
Thank you so much, Bridget. That was just a really powerful message and great advice for parents. I really loved when she said you just have to be a voice that won't be ignored. And I hope for all of you professionals out there that gives you some language to use with families when they need to advocate both for services and for public policies. We're now going to turn to a really esteemed panel to speak about advocating for policy. So I'm going to turn it over to Sarah and ask Susan and Shannon to both come. There you are, coming on camera. Take it away. Thanks.
Thanks, Donna. Hi, everyone. Sarah Brown, Senior Director of Government Affairs at Prevent Blindness. I realize I did not give my description, so I will do that now. I'm a light-skinned woman with brownish hair. Sometimes I think it's blonde. Today I curled it. I'm wearing a purple jacket and a cream-colored shirt. So I really just want to thank all of you who are watching today for being part of this important webinar, and to Shannon and Susan for being part of this discussion and this panel here with me today. So I'd like to start with a brief introduction of each of the organizations that you each represent here today, and ask that you each take a moment to share what your work is and provide us a few examples of that your organizations are currently involved with. And Shannon, I will start with you first.
Great. Thanks so much, Sarah. I'm Shannon Dree. It's a pleasure to be with you all today. I am a light-skinned woman with dark brown hair, a little bit darker than Sarah's, wearing glasses and a black shirt with a tan jacket. So I am here today representing the Save Rare Treatments Task Force. The task force is a collaboration of people living with rare diseases, patient advocacy organizations representing people with rare diseases, biopharmaceutical innovators, and others in the health sector, including providers dedicated to expanding access to rare disease treatments by protecting and fostering innovation that leads to new options and expanded indications for existing treatments. We know that there are a number of threats to innovation in the current environment, and continuing challenges in testing and expanding access to available treatments for people with rare diseases. So I work closely with the task force, and especially with up to about 30 patient advocacy groups that are members at this point, on how to make sure that policymakers understand what will be needed to bring about the next generation of effective treatments and cures for various conditions. Prevent Blindness is a member of the task force, and as many of you know, they are such a strong advocate for the research and innovations that will help people with blindness into the future, including innovations in diagnosis, innovation in new treatments, and hopefully innovation in more cures. So thank you so much, Sarah. I'll turn it back to you.
Thank you, Shannon. And Susan, over to you.
Yeah, hey everybody. I'm Susan Hepworth. Really happy to be here today. I'm also a light-skinned woman. I have definitely red hair and I also have freckles, and I'm wearing a very light, almost maybe bluish minty green colored short sleeve sweater. So it's very nice to be here today. I serve as the executive director of the National Coalition for Infant Health. That is a collaborative of professional, clinical, community, and family support organizations, as well as just individuals. And the coalition really focuses on education and advocacy, promoting all types of patient-centered care for infants and children and their families. So we have a volunteer steering committee that helps set our priorities every year, and that includes organizations like the American Academy of Pediatrics and the National Black Nurses Association and many more. And the majority of our work that the coalition undertakes falls into like a few different buckets. We do a lot of work with infectious diseases, vaccine and immunization access, nutrition, safety and innovation, a lot around prematurity, and then mental health as well. And this isn't related certainly to vision health, but in fact, tomorrow the coalition is going to be doing a joint campaign that will launch called Don't Forget Dad. It's an online campaign to raise awareness about fathers' mental health. So a lot of attention, of course, is paid to mothers after the birth of a child potentially experiencing postpartum depression or post-traumatic stress disorder. But the truth is it impacts fathers as well. So this campaign aims to educate about the risks and reduce the stigma so that fathers can get the mental health support that they need after the birth of a child. So that's just a bit of background about our coalition.
Thanks, Susan. That sounds like a cool initiative. So like you've probably guessed by now, we are going to move into what Donna called, well, contrasting with what Donna said as far as little a advocacy, we're moving into big A advocacy, and that's talking to policymakers, decision makers, legislators about some of the policies that affect and govern access to care, coverage, costs, and innovations and other access avenues. So my first question here is for Shannon. So Shannon, like you mentioned, your organization is really heavily involved in the Orphan Cures Act, and this is a bill that prevent blindness, among many other groups within the medical community, both provider and patient and others, has endorsed because it is such a positive step for patients in the rare disease community. And yet, for people who are facing a rare disease or condition right now, it might feel like it'll be a little while before they get to see the impact of legislation of this nature. So what would you say to advocates who have a story to tell about why it's important to get involved and advocate for bills like this?
Sure. Thanks, Sarah. It's a great question. And, I think there are a number of pieces within that big A advocacy that are important to folks involved with Prevent Blindness and others to think about. And they're kind of interrelated. So, as part of my answer, I want to talk about, right, like there's the diagnosis piece, there's access to affordable treatments that are already on the market and FDA approved. And then there's access to the innovation, which will lead to the next generation of those treatments. That last piece may seem far off for folks that have really urgent needs today, and in no way diminishes the need to advocate based on those urgent needs. But that last piece on innovation is particularly critical because without it, in many cases, we would not get to those kind of effective options for diagnosis and treatment in the future. Much of what is on the market today reflects investment choices that were made 20 or 30 years ago to get to that point where a treatment reaches the market and is able to directly help individuals. When you think about some of the innovations that we've seen as a result of bipartisan policies to support rare disease treatments, we've seen really revolutionary drugs that treat eye disorders, including things like inherited retinal dystrophy and others. So without those incentives in place, you don't get to a better future state. So I would say it's important where you can to prioritize advocacy based on what makes sense not only in the next few years for you and your family, but also what will make sense into the future and what will lead to those innovations that will really make a meaningful difference for people that have eye disorders and blindness.
Thank you so much, Shannon. And definitely, all of the messages that you just spoke to are reasons why Prevent Blindness, we do advocate on the EDV Act. We're excited about children's vision and eye health, but we do look at other activities that are happening within this space, especially for that impact on patients as a way to get involved and make sure that access continues to be the way forward for anybody who's facing any sort of condition. And most certainly, the EDV Act promotes those messages of early detection and intervention that can potentially help somebody identify if they have a rare condition and could benefit from some of the treatments that are out there. So my next question is over to Susan. Susan, like Shannon, you oversee a coalition that, among many things, is focused on promoting messages around early detection and intervention that I just spoke of. To that end, the National Coalition for Infant Health has been a really strong partner to Prevent Blindness and Donna with the National Center for Children's Vision and Eye Health on our work around increasing awareness of retinopathy of prematurity, or ROP. Susan, can you talk about the value of working in coalition with other organizations, and how does that contribute to achieving advocacy goals that are shared across different groups?
Yeah, sure. But I forgot to mention one thing earlier. I know that there's a lot of school nurses who are on today's webinar, and I just wanted to give them a quick shout out. It was actually because of a school nurse in an early screening that they caught, and she flagged for my parents, hey, I think you need to take Susan to the eye doctor, that I actually was diagnosed with amblyopia in my right eye. So I was able to intervene early and start patching my eye when I was probably in the first grade, and then getting glasses. But it was because of the school nurse. And essentially advocating for me that I was able to get access to not have my vision sort of deteriorate any further than it already had. So I just wanted to throw that out there for all the school nurses on here. So yeah, as Sarah mentioned, being a part of a coalition, like what benefits are there to something like that? So there's a lot of benefits for both individual people who want to make a difference, but then also other organizations who want to have a hand in influencing public policy in some way. So even if policy is not necessarily a priority for a specific organization, or maybe they don't really even know how it is to get started advocating for policy changes, coalitions are really good platforms to help individuals and organizations become more involved in affecting change. So by bringing together a lot of different stakeholders who all share similar goals, the coalitions can really help to share information, education, expertise, and really ultimately present a stronger and more unified voice to policymakers. And this unified voice is what often can result in greater credibility and greater visibility, making it more likely that decision makers are going to really pay attention to what is on your agenda or what you are asking for as it relates to policy change. So I just wanted to give an example of this. Sarah, our coalition has been very supportive of the EDV Act, as we've talked about before. Even though children's vision isn't the biggest priority for our coalition, nor are we experts in it. But it's because that we have the relationships that we have built as a coalition that Prevent Blindness was able to equip us with a lot of information that we can then also push out to our broader coalition memberships to try to drum up more support. So it's really like a strength of numbers almost, and being part of a coalition can make it easy for anyone to become engaged as an advocate, because we give the information and the opportunities to participate where it not necessarily be your main priority.
Thanks so much, Susan. And thanks for your shout out and sharing that personal connection that you have to vision and eye health. I don't know if you saw, but you were getting some kudos in the, so thank you for sharing that and the important role that school nurses and providers have in all of our lives. So this next question is for both of you. Susan, feel free to keep the mic or popcorn it back to Shannon. But the question that I have for both of you is, that we've heard a lot from parent advocates today who've talked about advocating for things like healthcare coverage and access to support services and treatments and others to help their child, especially, those who are facing a rare condition or facing blindness and vision loss, and what that early journey looks like for them. But in terms of legislative advocacy, and again, thinking about that big A advocacy, when you're advocating for policy change with lawmakers, are there any tactics that advocates can employ as individuals or strategies that coalitions and organizations use that individuals themselves can take on and emulate?
Shannon, do you want to go first?
Sure, I'm happy to. And I will say there are a lot of different options that folks can consider. And I would say all of these have kind of merit and can be useful depending on your level of comfort, geographically where you're located. But there's a few kind of traditional forms of advocacy. There's kind of engagement directly with lawmakers at the local, state, and federal level. There's kind of social media efforts that you can do, kind of posting about your experience and why it's important to support a particular piece of legislation or encouraging policymakers to fix that issue. There's also things like op-eds and letters that you can write. Oftentimes, organizations like Prevent Blindness are able to kind of help folks think about like what are important messages that policymakers need to hear, and what would be useful for the public to understand through an op-ed that's written. Oftentimes policymakers, most of my experiences at the federal level with policymakers are really moved by, what they are seeing in the media when they're seeing a lot of support behind a particular issue, or they're getting a lot of calls to their office about a particular problem. That often moves the needle. And I will say, I think, a number of folks, especially if they don't have a lot of experience interacting directly with government, can be intimidated by this. But it is really important where you can to be able to talk with individual policymakers. Sometimes at the state and local level, that can feel a little bit more accessible and easier to schedule. At the federal level, a lot of folks will work with organizations who kind of plan fly-ins and other things. But being able to talk to policymakers and their staff is a great way to elevate an issue and help them understand something they otherwise would not. And, when you think about what messages are important for folks to hear, right? There's a level of honesty that's truly helpful for policymakers to understand directly what you experienced with you and your family, what that has meant in terms of barriers and access to healthcare, and what you want them to do about it. We have heard pretty consistently across virtually every healthcare related issue that I work on that there is nothing more powerful than direct patient and patient caregiver and family stories to help them better understand an issue. I'll also say, you can kind of arm yourself with the data and some other points. So making that personal connection with your personal story is really helpful, but where you're able to supplement that with data based on what is happening within your community, kind of eye disorders and blindness community, that can be really powerful for that particular staff or that policymaker to bring to their colleagues to say, I heard this woman's story that was so powerful, and this is why we need to act on it. This is something that's affecting people in my district or in my state, and I know it's affecting people in your district and state too. So there's a lot of different things that you can do. I think voicing that interest to organizations like Prevent Blindness, that's a great step. And thinking about what parts of your story are most important to share, and what do you think needs to happen so that other families have a better experience than you're having with some of those barriers that you're experiencing in accessing healthcare.
Thanks so much, Shannon. And Susan, to you.
Yeah, and I would just kind of elaborate on what Shannon said. So when I think of from the organizational perspective and how it is that we approach advocacy with lawmakers, I think it, for me, kind of falls into three buckets. There could be more, but I'm just going to illustrate these three now. But really, I think the first step is raising awareness about whether it is a disease, a condition, what is the issue. But policymakers first have to understand that there's even this issue that's happening out there. Unless you are an expert on many health-related things, you're probably not going to know that those problems even exist. So if we want policy change of some kind, example related to retinopathy of prematurity, perhaps it is access to therapy or treatment for that. Policymakers first need to know, okay, well, what is retinopathy of prematurity? Who is impacted by it? What are the long-term outcomes? So the coalitions often participate in campaigns that first raise awareness and help lay the groundwork for future policy change. Sometimes I liken it to growing a garden. So you don't just throw a seed on the grass and then expect in 2 weeks for you to have a big, beautiful garden. no, you have to like till the soil. Maybe you have to bring in some topsoil, and then maybe you have to bring in some plant food, and then you have to water it. So like there's a lot of level setting that has to be done in order for policy change to occur. The second thing, and I might talk a little bit more about this later, so I won't belabor it too much, but utilizing data, I think, is also important to tell the story and the impact and why policy change is needed. But oftentimes data is quite complicated to understand, especially if you are not an expert trained in that area. So we really prioritize breaking down complex data into bites that policymakers and advocates will understand. And then I would echo what Shannon said about local information, like local data and local stories is also going to be most impactful for your lawmakers. So yes, they can know about what's happening 1,000 miles away, but they really want to know what's happening in their district with their constituents. And then the third thing I want to mention, and maybe most importantly, like Shannon said, is really telling the human stories that demonstrate the impact and the need for change. So I think when you have the stories of the people affected complemented with local relevant data can be really compelling and help to move the needle with policymakers.
Absolutely. Thank you both, Shannon and Susan, for that wonderful answer. And, I know that there's probably some parents out there that have heard some of the ideas that we've been discussing today and just thinking, why should I get involved? Why should I care about, when it comes to the EDV Act, legislation that'll help states and communities? Well, this is information, that's funding and resources that will translate down to the individual and family level. At least, if it's something as small as making parents aware of a vision condition and just the fact that it might affect their child and their learning and their development, even that is powerful in itself. But really creating those systems of care for early detection, intervention is really important to, to make sure that children are accessing care. And so we feel that this legislation is going to be really a game changer. And so I encourage all of you to get involved. If you are representing an organization and you would like to sign your organization onto the EDV Act, please go ahead and contact me if you would like to do that. And I'll put my email in the chat. I'm here to answer any questions about that. But we've got over 100 organizations that have endorsed this bill. And so it's really exciting to see that much support behind this legislation. And we really think that it will do a world of good for parents and families and just the general public to understand just that there is a pathway forward for early detection and intervention for children's vision and eye health conditions. So I think at this time we might be coming up a little bit close to time. So I will turn things back to Donna to facilitate any Q&A from the audience. And it looks like we've got a couple that are coming in. But Donna, while you're coming back to camera, I'm happy to answer a question that has been posed to us at registration, and that is this. So what can you do in situations when it seems like lawmakers are not listening to you, or that they hear your story and your ask of what you want them to do, and then they go ahead and do the opposite thing? So happy to give that one to Shannon or to Susan to answer and to respond. I think that's a great question.
And then before you do, I'm just going to ask the other presenters to stay on mute for a moment, but come back on camera for all the questions. Thanks. Sorry, Shannon.
Thanks, Donna. No, this is, something that, if you do a lot of work in federal policy, you unfortunately do see a good amount of. There's a lot of issues that come up. There are a lot of stakeholders that advocate on different sides of those issues. So it can be really frustrating when you feel like you're telling your story, you are, really putting yourself out there to make a policymaker understand your perspective, and they are just not hearing you. To give you an example, so I, as Sarah mentioned, work on the Orphan Cures Act, which is a piece of legislation that's designed to protect incentives for rare disease research and development. A struggle that I have had in working with patient advocates talking about this issue is that some policymakers don't see the concrete impact of the policy that we're concerned about playing out in the marketplace yet. They will hear individual stories sometimes and say, well, there's not the data to support that this is already happening. So, one thing that we have tried to do as a task force is to gather the data and kind of bring back the evidence that some of those policymakers need to better understand this issue. And then another thing that we have tried is really kind of working together as a group of patient advocates to say, you know, what are the messages we know are the most compelling, and how do we come in as a resource to some of those conversations to make sure that they understand that we all want to work on the same team. We want to improve access for people with rare diseases. And this is an important priority. It's not a partisan priority. It's not, you know, something that someone would not want to support. So, you know, sometimes it involves some pretty frank conversations with some of those staff and policymakers to say, you know, this really is a concern for us, and here is why. And sometimes it takes more than one conversation. You know, a lot of folks will do an initial conversation, but with, especially at the federal level, the follow through and kind of follow up with those policymakers to make them understand an issue over time is really critical. Susan's analogy to planting a garden is a really great one, because it takes a long time to see federal policies move. And in order to do that, you have to have an educational base across a lot of different policymakers. And it's often continued and expanded education that gets you to that point. So I guess the essential part of my long-winded answer is to say, don't give up. One staffer or one policymaker doesn't mean that your issue isn't important or that you won't be successful in the end. A lot of it is trial and error, and a lot of it is kind of continued pushing, because I will say there are few stronger communities that I've seen than the, you know, people and parents of people with rare diseases, including rare eye disorders. Like, you've been through so much in terms of your healthcare journey. You can weather the storm in terms of what that advocacy journey looks like to come to those better outcomes. So hopefully that is at least a little bit helpful.
Thanks, Shannon. And I agree, Susan's garden analogy was fantastic. And I do not want to steal her thunder by saying this, but sometimes advocacy is planting trees or planting seeds for trees that you'll never get to sit under. So keep that in mind and stay the course. Donna, any other questions?
Oh, well, Sarah, I was
Hey.
just, yeah, just
Yes.
what
Go
you
ahead, Susan.
Please go
Yeah,
ahead.
what you said there at the end too. You know, there's a real level of altruism when it comes to parent and patient advocacy, and that you may not see the impact for your child specifically, but you can be making an impact for a lot of, you know, future children. So just keep that in mind if you're becoming a bit discouraged because things are not going your way right away, that this is for other people too.
Absolutely. Thanks,
Thank
Susan.
you. Thank you to the panel. That was so informative and, again, inspirational. That word just keeps coming up. I want to throw a question out to Nicole and Bridget as in your roles as parents. And this is for folks who are a little nervous going to Capitol Hill for the first time, or a little nervous to give testimony. And so I just wanted to see if you had a couple tips. How did you get over that nervousness to tell your story to people who are sitting in either on the local level, the state level, the federal level? What couple tips you have, or how did you do it? Let's go Bridget, then Nicole.
Okay. Hey, everybody. So, to be completely transparent, I still have not fully gotten over my nervousness. However, I do know enough that, you know, on the other side of that nervous feeling is the potential for change. So, I literally cried on Capitol Hill, you know, in December trying to give a speech. And you know, it really shows, you know, the passion, you know, and the realness of it. I would just say kind of suck it up, you know, go for it, maybe make some notes, get your talking points together, you know, if it's an opportunity for you to be able to, you know, speak. However, nerves and all, you know, give it what you got, because a lot of that crying, you know, really probably made a difference for somebody looking in, like, wow, you know, this woman is really passionate. Wow, you know, this is really something that we need to really hone in on, and take a closer look at. So I just would encourage you to go for it, you know, nervous or not, because on the other side of that, you know, is the potential for some change. And like you mentioned before, even if it's not change, particularly to you or your situation, it's definitely, you know, something that's going to be helping somebody else out there.
Mm-hmm. Right. So getting over your nervousness to pay it forward is so important. And I'll just tell everyone, when we recorded Bridget, she had one practice and then she did it again. And so practicing before any kind of speaking, advocacy is also really important. Nicole.
So, I remember the first time I ever spoke to individuals, especially on Capitol Hill, I had a lot of prep work. At SPAN, we are bipartisan, but then, I had some prep work that helped me to be able to talk about my points and stay focused. I find that what helps me is writing my points down so that I can stay focused on what I'm trying to get the point across. And so, and over time, for me, it became much easier. And I just see them as a person. I don't see them as a senator or Republican or on this one and that one. I just see them as a person that I'm talking to and hope that something that I say resonates with them. Because it's my story among a lot of other stories. And many times you're talking to legislative aides. And so I just see them as a person, and I'm just sharing some information that I feel it's important for them to hear, that hopefully they'll be able to use to push different legislation or funding forward.
That's great. I really appreciate that. A couple of other questions have come in that are more specifically on vision screening. So I'm going to reach out to those of you, someone from Head Start, a couple other people. I'll reach out to you individually on that. I just want to, I think we're going to start to wrap up. I want to really profusely thank our whole panel for all this information. And I hope that all of you have taken away some good nuggets to share both on the professional level and with families to help us advocate on behalf of children, whether it's vision, other health issues, telling stories, sharing facts. It cannot be more important. While I'm getting ready to share my screen again, just to wrap up with some additional, a few additional slides, and give some resources. I do want to mention that the clip of Nicole and her short testimony for Congress on Medicaid, that is her perspective. You did hear Senator Andy Kim before and after. We are a nonpartisan organization at Prevent Blindness. We don't endorse any statements that he was making. And just to let you all know that was him, and Nicole was just we were showing her clip as an example of advocacy. So just wanted to make that clear. So we will be sending out resources in the next couple of weeks along with the recording. So we'll send you more information on the EDV Act and some other tips for advocacy, some of the resources from the National Center, and some of the links that the presenters shared themselves. You can always reach us at info@preventblindness.org. And again, Ann just put this in the chat again, contact Ann for a certificate of attendance. Happy to create those for you. And Ann, I think, is going to put the link in if she hasn't already. And we'll send this out tomorrow again. We really appreciate, again, your feedback on the evaluation. And we want to thank you all either for any advocacy you've already done and for advocacy that we hope this webinar has inspired you to do in the future. It is only through advocacy that any change happens. Prevent Blindness was founded back in 1908 on an advocacy issue that we advocated on the national level and through all the states. And you can read our history on our website. And so advocacy, change will not happen without advocacy. And don't forget that you as an individual can make a huge difference. So I want to thank you all the participants for being with us today. And again, thank our panel and everyone at Prevent Blindness who helped bring this webinar to life. So thank you all and have a great day.